It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, it's a brand new location, folks, for the Lehigh Valley Health Network. It's the Lehigh Valley Physicians Group, Brookhill Plaza. I'm here with Melanie, and she's going to tell us all about this exciting place. It is absolutely beautiful, located in a great place, Melanie. So why did, I keep saying Lehigh Valley Health Network, they keep raising the bar. Why did they decide to come down here to Brookhill?
Well, Lehigh Valley Health Network is always looking at expanding our health care services, providing more health care services in areas that may have been underserved or maybe just expansion. Here at Brookhill Plaza, there was another empty storefront in which we want to utilize and bring more health care services to an area that we believe needed more services. Currently here at Brookhill, we brought down our pediatricians. We have Dr. James Caggiano, Dr. Stephen Glicken, Dr. Alvaro Raimonde, and we have two physician assistants, Laura Temprine and Alicia Wainwright, who will be rotating services here in the Valley. In the last year, we had a new office open up on Broad Street in Hazleton, and at that time of opening the new office and relocating over to Broad Street, we thought that we need to open another new office to accommodate those in the surrounding communities. We understand convenience is very important, especially dealing with sick kids. We're located right in front of Valley Elementary School, right across from the Valley pharmacy and supermarket. So we thought this location would be perfect for everybody's day's needs of on their way home from work or school. We also want to provide internal medicine services, so we could offer healthcare services for infants through geriatric medicine. So we recruited Jennifer Yourey, who's a certified nurse practitioner who works in collaboration with Dr. Washinsky and Dr. Lenko to provide adult medicine. So our ultimate goal is to be more convenient to our patients in all of our surrounding communities and continuously raise the bar offering quality medicine.
Now, I know they're doing an excellent job on Broad Street Express Care, okay, of course the hospital as well. If someone's, what will you be treating here? I mean, for example, if someone is getting sick, they feel sick and they feel it's an emergency, can they come here? I mean, because you're in close proximity of a lot of people, or what would you advise?
When in doubt, if it's a true emergency, I always say call 911 or go to the emergency room. For basic health conditions, you may have allergies, or you may have the flu, you may not be feeling well and you think you may need an antibiotic. We welcome you to come in and stop in. You get a call from school, your kid's not feeling well, call the office. We'll get you in on your way home from school to your home. You are not feeling well at work, give us a call. We'll get you in. One thing that we want to focus on here at this location is offer early morning appointments, obviously during the day between 9 and 5, and some evening hours. We want to offer convenient hours for everybody. So we are not a walk-in urgent care facility. We always say that if it isn't an urgent care, go to our express care.
Yes.
But since we're opening up and it's just a new practice, we will welcome walk-ins, but we do encourage appointments for future use. But this is basic general medicine for pediatrics through geriatrics, treating common health conditions. But when in doubt an emergency, I recommend either go to express care or the emergency room.
All right, so folks, today we're going to talk to Jennifer Yourey and my good friend Dr. James Caggiano, talk about this great place that Lehigh Valley Health Network is bringing in Hazleton. Remember we said when Lehigh Valley came in that it's just going to explode? Well, it is exploding, and it's great for our area, fabulous for our area as far as healthcare is concerned. Now let's talk to Jennifer. We're here at the Lehigh Valley Physicians Group, Brookhill Plaza. And you heard Melanie talk about Jennifer Yourey. And she is a certified registered nurse practitioner. And that's a lot to say, isn't it? Yeah, that's a lot to say. So tell me, what is a certified registered nurse practitioner?
CRNP for short. How's that?
That sounds better.
That is an advanced practice registered nurse. That's also what some people refer to us as. I'm a registered nurse. My background is an emergency room nurse that went back to school, got my master's degree in nursing, and then got advanced training. Then sat for a board certification with the state somewhat to a point, and then a national certification to pass an exam, and then now practice as a advanced practice nurse.
Now that's covers a lot, okay? Tell me a little bit about yourself now. I mean, what school do you go to? And
my schooling was through South University in Georgia for my advanced training. My undergrad was Alvernia University, and my RN training was Pottsville Hospital School of Nursing.
Now we talk about specialties, okay? What are some of the specialties that a certified registered nurse practitioner has, okay?
It could vary. My own is internal medicine. I'm an adult, which my scope of practice is actually from 12 years of age and older. And then there's geriatric, there's emergency room nursing. There's any type of specialty out there that you could think of, actually.
So how long does it take to become a CRNP?
After the diploma program, you could go back for your bachelor's, which is what I did. And then after that, it took me a little over 2 years full-time to become a CRNP.
Now, are you going to be placed here?
Yes, I'm going to be here in the Brookhill office.
Okay, so what are some of the conditions and problems that can you treat?
I can treat anything from acute problems such as colds, flus, viral illnesses, allergies, which is prime time. Prime time right now, yes. To chronic problems, COPD, asthma. Also not just sick things, to just well visits. If you come in once a year just for a checkup, just to make sure you're healthy and there is nothing. Because a lot of times you come in and you don't think there's anything going on, you're not having any symptoms of anything, and things are caught upon these well visits.
That's fabulous. So I'm taking Claritin. Is that a good thing?
That's a good thing for your allergies, yes.
This year,
that's helping.
Well, this is terrible this year, isn't it?
The allergies are very bad this year, yes.
So I'm sure you get a lot of people coming in from allergies.
Yes.
Okay?
Yes.
I'll be one of them. What medications can you prescribe?
I can prescribe anything from your allergy medicines, even though some of them are over the counter, Sam, to everything up to including things that require a DEA license.
So you basically do a lot, okay, as a so if I come in there, most people say, well, I want to see the doctor, okay, which I understand, but seeing a person like you, they're getting excellent care. Am I correct? I
believe so, yes. I have many years in emergency room nursing as my background, up to and including I work very closely with a collaborative physician by the name of Dr. Jody Lenko. I've been a CRNP for almost 4 years, so I do have a lot of background and training behind me.
How long have you been with Lehigh Valley Health Network?
I've been with Lehigh Valley Health Network a few months, now, yes.
So what do you think of the Lehigh Valley Health Network?
I love them. I'm very happy, very satisfied. Yes.
Yeah, they do everything the best.
Yes.
They do everything first class.
Yes.
And, and they have a passion for better health.
I agree. Yeah. Yes, they're on top of everything from head to toe. Yes.
So now this is all computerized as well.
Yes,
so if I'm coming in here and I do, if I went to one of your doctors in the network, you could certainly pull up my chart and know exactly what the case may be.
Whether you go from another provider to one of the express cares to the emergency room, or you're an inpatient at the hospital, we can link to that and see that, yes.
Now, do I need an appointment to come and see you?
As of right now, we are accepting walk-ins because we are a fairly new office that just opened up. So we would see you right now as a walk-in. We also prefer appointments right now, and in the future, yes, appointment would be needed.
Now, you're working with other doctors here as well, right?
Yes, we have Pediatrics on the other side of the building, yes.
Yeah, and you're working with good people.
Absolutely, yes.
They're all pleasant.
Yes.
Which is, because when you're bringing your kid to a doctor, you're always nervous, or if you're coming into and I'm the biggest baby walking the face of the earth when it comes to medicine. But it's just a nice thing,
yes.
that Lehigh Valley Health Network cares about their communities, and they really get involved. As you can see, they take empty places and they make great things out of them. Phone number's on the screen, folks. We're talking to Jennifer Yourey, and we'll be back right after this. Welcome back to the Sam Lesante Show, folks. We're here at the Lehigh Valley Physicians Group, Brookhill Plaza, brand new location. Phone number's on the screen, and I'm talking to Jennifer Yourey, who is a certified registered nurse practitioner. So we learned a little bit about what you do as a CRNP. Now, when you talk about a well visit, what is a well visit?
A well visit is a visit sometimes even offered by an insurance company, and there's also offered with an incentive with insurance companies now, gift cards that they give patients to come in to see us once a year. Sometimes there's no co-pays even associated with that. And you come in, overall head to toe physical, blood work, all covered by the insurance company. You're not sick, you have no complaints, just come in, head to toe exam, and out the door you go. A lot of times we do find things on that exam, underlying condition that something comes up in the blood work, an example, diabetic, we find that you're diabetic. Versus a sick visit where you come in with a complaint, a cough, a cold, things like that.
So now you do work with other doctors. So in other words, if I'm feeling sick, or I come in here, but my doctor is Dr. Benyo.
Yes.
Okay, and so you collaborate with him?
Yes. If I ever have a question or concern, Dr. Lenko, Dr. Gorski, Dr. Benyo, they're just a phone call away. So if I have a question, concern, or I'm not sure of something, I pick up the phone and I do reference one of those and call them and discuss the case with one of those.
That's terrific. So in case someone just going through the channels and they pop in and they're seeing this beautiful girl here with this handsome guy.
Of course.
Who was that? I don't know. But anyway, explain again what a CRNP is.
A certified registered nurse practitioner.
Okay, and you go through a lot of training to
Yes.
do what you're doing. Okay.
Yes.
Okay, now we'll talk to my good friend Dr. Caggiano. I'll talk to my good friend Dr. James Caggiano. Jim, how you doing?
I'm good, Sam. How are you?
How's the family? I'm doing fine.
They're all fine.
Yeah? Girls doing okay?
Yeah.
That's good. Now you're at an exciting place here.
Yeah,
This is
it.
really nice.
It
Really
is.
a
It's
nice
beautiful.
addition. So basically, what will you be doing here?
I'm going to be doing the same thing that I do most of the time, and that is taking care of well and sick children. So this gives us an opportunity to have better access for the people who are in this neck of the woods. So that's good for them, and we're able to do all of the things that we did in the other office. And it's a nice venue. They did a really good job fixing the place up.
It's first class, and all the latest technology. I mean, now the other doctors that you'll be working with are whom? Who will be? I know Melanie mentioned them, but
Yeah, Steve Glicken and Alvaro Ramundi are the other two docs on the team, and we have two physician's assistants, Alicia Wainwright and Laura Schallenberger. So everybody's going to take their time down here.
now right now you're taking walk-ins, right? You prefer appointments, but you're
I think that we're still pretty much doing mainly appointments.
you are
Yeah.
for pediatrics.
Yeah.
I know the Jennifer Yourey said there's
She's doing some walk-ins for
walk-in. The quality of care. Okay, you've been with, how long you been with Lehigh Valley Network now? I mean,
Well, the hospital merger occurred about, I guess, January in 2014.
yeah. So working with them, okay, you worked here a long time. What do you see in terms of quality health care with the merger coming in here?
Well, I think that what we've seen is that the capabilities that the local hospital has are just keep getting better and better. We're more firmly connected to Lehigh in terms of things like stuff that I don't deal with, like stroke care and all that sort of stuff. But they've done a lot to get us in touch with our counterparts in Allentown. So if I have a patient who has a difficulty, I don't have to go hunting around and deciding, well, where am I going to go and who. So I have the same kind of access to the folks at Lehigh that anybody down there would have, and it makes a big difference to be able to call up a specialist in, for example, pulmonology and say, I've got this kid with this, that, or the other thing going on, and they're very, very helpful. They're very supportive, and they want to help us take the best care we can of our patients. So that's really a big deal.
When you're looking for health care, and since 1994, even before Lehigh Valley Health Network was brought into the picture, I've always told my viewers here is that we have great doctors in this area. I mean, I know one time people thought they had to go out of the area. I think that's sort of done now. I mean, other than some serious operations. But when you talk about the quality of doctors and the healthcare, the assistants, physician assistants, as we heard from Jennifer, they just keep raising the bar, don't you think, Jim?
Yeah. I think that's really true, and I think that we've definitely had some some halo effect from being part of Lehigh, because that's a recognized name in the Pennsylvania health community, period. So that there's some name recognition, there's some understanding that, yes, behind us are people providing additional kinds of care. We have better ability to standardize our care with just the best people practicing in the business now. So that's really, really helpful.
And you know what's comforting? This office here in Brookhill is just very comforting. I only live 2 minutes away from the place. But, the thing is that for those people who may be sick or their children, okay, you're here, it's right in their back yard. And knowing that you have this great team supporting, just like, wow, you have the Lehigh Valley Health Network right in your backyard. I mean, that's a great comforting feeling.
Yeah,
hope I never have to be as serious, but
right.
The point is, for yearly checkups or
Sure.
for you bringing your children in, I think that's a great opportunity, don't you think?
Yeah, it is.
Now you're going here as well as Express Care, all right?
That office, yeah, I don't work in Express Care, but the pediatric department shares space in the suite with Express Care.
Well, I'll tell you, as I said to Melanie, they spared nothing here. They just made a tremendous investment. You talk about a commitment.
Oh yeah.
They made a tremendous commitment here.
Yeah, they did, and they continue to. I mean, it's pretty clear that the practice is going to continue to expand both here and in town, and we're looking forward to having additional practitioners to further meet, people's needs.
Well, it's always nice talking with you, Dr. Caggiano, folks. No stranger to the greater Hazleton area. How are those little kids doing? All those little kids coming in this year, huh?
Hopefully they're all doing fine.
It always fascinates me, a pediatrician, a doctor like you have to, you're dealing with young children, okay? You're dealing with parents that are sometimes, really nervous and excited about their kids, and especially when they're sick. You have to have a special demeanor, to calm down the parents, the kids sick. I mean, you have to have a special demeanor.
You have to remember what it was like when you were in their shoes, that's all.
Yeah. And that's what I find with a lot of the doctors in Lehigh Valley. They have that bedside manner, okay?
Yeah, empathy is important.
It's very important, and you do a great job. You do a great job. Folks, Dr. James Caggiano, and remember, we're here at the Lehigh Valley Physicians Group, the Brookhill Plaza. It's a beautiful place, as you see, as I was talking to the various people. And we hope that if you need health care, you come to this place. Well, there you have it, folks. We're here at the Lehigh Valley Physicians Group, Brookhill Plaza, brand new location. You heard from Jennifer, you heard from Dr. Caggiano, and now we're back with Melanie. And Melanie, all I can tell you is that there's no question about the fact that Lehigh Valley Health Network has made a tremendous commitment to the greater Hazleton area with this place. I mean, so once again, just for a review, what can people expect from this beautiful addition to Lehigh Valley Health Network?
Lehigh Valley Health Network is continuously offering quality health care in surrounding communities. Here at the Valley Sugarloaf location, we offer infant through geriatric medicine care. We welcome patients from the surrounding community to come down here and see our pediatricians or Jennifer Yourey. And I can promise you, this is just a start of many services to come. We only have pediatrics internal med, but at a later date, we will be rotating our other specialists down here. So this is just a beginning to serve our community.
So who's here right now? The doctors and the nurse practitioners who are?
Currently, right now, we have Dr. James Caggiano, Dr. Stephen Glicken, Dr. Alvaro Ramonde, and 2 physician assistants, Laura Temprine and Alicia Wainwright, on the pediatric side. And we have Jennifer Yourey, a certified nurse practitioner who works in collaboration with Dr. Jody Lenko, who's internal medicine.
All well qualified, certified healthcare specialists that are here. It's just a great audition, to the Lehigh Valley Health Network. Folks, so phone number's on the screen. It's a brand new addition to the Lehigh Valley Health Network. It's the Lehigh Valley Physicians Group at Brookhill Plaza. Phone number's on the screen. You'll be pleasantly surprised when you visit here. We'll see you next time.